And
Yes, as
Q.
we are now going to introduce everyone. We have six participants who will be presenting today. They are ROJDonors HelpThru against COVID-19 excellent practices participants po. So shall we begin with our first coordinator po and present.
Yes.
So for from Albay, let's welcome Dr. Amy Rivera.
Yes, Doc.
Hi.
Hi, Doc.
Hi.
Yan, we're here.
Hi. Good evening.
Hi,
Good
Doctor
evening.
Hello po.
Dr. Ali.
Good evening po sa inyo.
Call me Dr.
Doc, don't
Ali.
forget to, paki-ready na po yung slides if ever.
Okay.
May, Ann, Rosh, baka gusto niyo muna intervene si Doc habang pinaprepare niya yung slides niya.
Doc, kamusta naman po dyan
Share
sa
screen ba
Albay?
ako?
Yes, we can hear
Sige
you
po,
po.
share screen na. Share screen.
Yes po.
Yes, Doc. You can start pag ready na kayo. Nakita ba yung logo sa likod ni Doc? Ready.
Kitang-kita po. Ayan.
The
Kitang-kita
new
po
logo.
Ay, antaray.
Doc, you can start na po the slideshow anytime.
Okay.
You can full screen it na po.
Okay.
All right. So, let's give
I'm
the
okay.
floor to Doc po. All right, Doc.
Okay. Good evening. I am Dr. Amy Rivera, and I will be sharing with you the excellent practices in protecting healthcare providers against COVID-19 at the Bicol Regional Training and Teaching Hospital. Bicol region is composed of 6 provinces: Camarines Norte, Camarines Sur, Albay, Sorsogon, and the 2 island provinces of Masbate and Catanduanes. COVID-19 cases have been reported in the whole of Bicol, but the most number of positive cases is in Camarines Sur, followed by Albay. However, Albay has 4 COVID-19 deaths, while Camarines Sur, Camarines Norte, and Sorsogon only have 1 each. This is our hospital, the BRTTH. It is located in Legazpi City, Albay, and is one of only 2 COVID-19 referral centers in Bicol. As of July 14, BRTTH has attended to 1,757 COVID consultations and has had 359 COVID admissions. The next few slides will show the different prevention and control measures that BRTTH has designed and implemented. The triaging system is a very important control measure in the hospital. Patients are given instructions on what to do and where to go through signages that are prominently displayed at the hospital entrance. Suspected COVID-19 patients are immediately identified and directed to go to the appropriate COVID tent where they are evaluated and examined by the designated COVID resident on duty. All cases are referred to the infectious disease consultant for final disposition. Tent 1 is for non-emergency COVID consultation, while Tent 2 is for emergency COVID consultations. Non-COVID emergency cases are seen at the regular ER. Training on donning and doffing of PPEs were conducted for all healthcare workers. Safety precautions like wearing of face masks, goggles, face shields, gowns, frequent hand washing, and alcohol hand rubs were observed. Direct isolation wards for COVID cases were put up in areas away from the regular hospital wards. These isolation wards are manned by a dedicated COVID team of doctors and nurses. The hospital also has an operating room and delivery room for exclusive use of COVID-19 patients. During a procedure, only a limited number of COVID team members are allowed inside. Physical distancing is complied with both at the OPD and in the wards. In the wards, beds are placed about 1 meter apart. At the OPD waiting area, patients are seated 2 seats apart. Patients with symptoms of acute respiratory infection are also segregated. At the OPD, they have a separate entrance and they are seen in a separate section. To lessen exposure and risk of transmission, skeletal workforce was implemented in all areas. Instead of 5 to 6 residents going on duty every 3 days, they would now go on every 4-day duty with only 3 to 4 residents per team. Consultants were allowed to work from home and report to the hospital only when necessary. Meetings, conferences, and teaching sessions are done online. Other preventive and control measures include the following. All hospital employees underwent RT-PCR testing. Infected personnel were isolated and treated. Even for asymptomatic cases, a 14-day quarantine period was strictly followed. Before they were allowed to go back to work, clearance from the infectious disease consultant was required. There is a dedicated COVID duty team for all the clinical departments. COVID teams go on 2-week straight duty, after which they go on 2-week quarantine. RT-PCR testing is done a week after their last day of duty. Movement of people within the hospital was restricted. Only 1 companion is allowed per patient at certain hours, and they are to stay only in the area where the patient is confined. Colored IDs were issued to personnel to make sure that they remain only in the respective work area. Retrofitting of different hospital areas are ongoing. The emergency room, the COVID OR, the non-COVID OR, and the LRDR are to be converted into negative pressure areas. Patient admissions and OPD consultations have been limited to only high-risk and critical cases that need tertiary level of care. All other cases are referred to other health facilities, hence the need to strengthen the service delivery network of the province. A meeting was held with government and private health facilities to inform them of the new normal policy of the hospital. Telehealth workflow is still being finalized. Telemedicine is intended to screen and service patients seeking consult to our hospital. This will also be used to help doctors manage patients that were referred to them. As I come to the end of my presentation, the question to be answered is, was BRTTH effective in protecting its healthcare providers? Let's take a look at the following performance indicators. The case fatality rate for the province of Albay is 4.6%. 4 out of 87 patients died. Among the 1,458 BRTTH employees, 15 were infected, but all have recovered. In all COVID-19 referral centers, it is inevitable for some of its healthcare providers to get infected. We have seen this in even the more sophisticated and well-equipped hospitals in Metro Manila and Cebu. BRTTH is no exception to this. However, with only 1% of its personnel being infected and with 0 mortality, it can be said that the hospital's safety practices were effective in protecting its healthcare providers. The BRTTH management and staff is grateful to Dr. Ray Hosson and to all the generous donors for the PPEs you sent us. We are committed to continue our fight against COVID-19, and your show of support is truly encouraging and inspiring. In our native tongue, I say, Diyos mabalos. Good evening.
Hello. Yan, we're back. Hold on. We're pulling in Anulet and Rosh, Doc Hosan.
Yeah.
Ayun! So yun,
Oh.
thank you for the presentation, Doc Alma.
Thank you,
Thank you so
Doc.
much. Diyos, mabalot.
Doc,
Tama ba yun, Doc Alma?
Bicolana.
presentation,
Bicolana din po ako.
Diyos mabalos, Ro.
Wala. Ulam lang alam ko sa Bicol. Wala akong...
Bicol Express.
Wala, Bicol Express. Yun lang alam ko eh. Doc Hosan,
may
anything you
question
wanna
ba
say po? Yeah, questions
No.
or ano po?
None. Okay. Congratulations,
Alright.
Ami.
Thank
Thank
you.
you.
Congratulations, Doc.
Bye.
Next
Alright,
presenter?
Doc. Next presenter na tayo. Okay, Ann.
Our next presenter is from Zamboanga del Norte. Miss Patricia Cuema. Is that right? Is that how I pronounce the last name?
Mamaya,
Doctor.
malalaman mo kung mali o tama.
Maitanong nga natin kung tama ba.
Wait,
Pasok,
is she here?
Doc.
I don't think she's here. Rosh.
Nandyan. Doc Chica. Queen.
Ayun, she's here.
Cuema.
Hello?
Hi, Doc!
Hi,
Doc.
can you hear me?
Hi,
Hello
Doc.
po.
Hi, Doc.
Yan.
Ang
So,
ganda naman
again,
ng nickname mo, Doc. Is that your nickname or real name ba yan?
Nickname
Tama
po.
ba yung pronunciation niya ng last name mo, Doc?
Kema po. Kema.
Kim.
Kim,
Wala na
ah.
ba?
Yari ka. Ano ka?
It's okay. It's
Ah,
okay.
napansin mo
So-
ba yung earrings?
Ay, ang
Grabe,
ganda.
no?
Ano?
Yung earrings
Ayan,
niyan.
earrings. Ang taray.
Oo. Pag yan sinangla niya, yung 4 million natin pwede maging 4.5M. Na pang-donate.
Pwede.
Ganun
Doc,
kamahal yung
donate.
earrings niyan. So again, we'll give the floor to you, Doc, Doc Kema, no? So, the floor is yours. Please, ready your PowerPoint presentation now. You can share your screen anytime. Ako ba mag-ready? Ako pala, no?
No, Mimi.
Si Doc.
You. Okay. Sige. We'll wait for your PowerPoint presentation. Chika muna. Mga inaantay.
Doc,
yun.
kinakabahan ka ba sa presentation mo?
Hindi.
Okay lang.
Hindi, nakita ko na lahat.
Ayan, ready na si Doc.
Presentation
Doc Emma,
na
Doc
po.
Emma. The floor is yours.
Yes.
All right.
So, to the organizers of this event, ROJDonors through Dr. Ray Hosson, MuRelief, and of course HelpThru, to the esteemed judges, Dr. Hamoy, Dr. Cordero, Dr. Redoble, and Dr. Hernandez, to my fellow sharers, and to the watchers, a pleasant evening to you all. I am Chica Kema, Mu Sigma Phi Sorority Batch 2019, a newly deployed doctor to the barrio. Currently, I'm serving as the Municipal Health Officer in the municipality of Polanco, Zamboanga del Norte. Before anything else, I would like to thank you for this opportunity to share with everyone our best practices here in Polanco. My report will be proceeding as follows. So, the municipality of Polanco is a third-class municipality in the province of Zamboanga del Norte with a current population of approximately 41,000. It is politically divided into 30 barangays, and the livelihood is mainly agricultural. Managing a pandemic in a low-income, far-flung municipality poses many challenges. It demands resourcefulness, dedication, and a lot of hard work. Fortunately, the lockdown has bought us some time to prepare as much as we can for our COVID response. Our strategies, in line with that of the nationals, can be divided into four main categories: prevent, detect, isolate, and treat. We developed campaigns, programs, and policies for prevention. We strengthened our detection and surveillance. Isolation logistics and protocols were developed to effectively contain the virus. And lastly, treatment and appropriate case management are to be carried out for any symptomatic cases. Our prevention strategies mainly focused on strengthening the community's understanding and participation in the COVID response. The first thing that we did under this strategy is the establishment of the Polanco Interagency Task Force as early as March. It is chaired by the municipal mayor and vice chaired by me, the municipal health officer. Weekly meetings have been conducted to address concerns and to adequately prepare the community for this pandemic. We have also passed several new normal policies. To date, a total of 18 COVID-related executive orders have been signed by the municipal mayor under the guidance of the IATF, and to strengthen this, one municipal ordinance has also been passed. One EO of note is EO number 31, series of 2020, which serves to implement the minimum public health capacity standards in Polanco. I believe we are one of the first municipalities in Zamboanga del Norte to adopt this. So here are some of our new normal setup. So mandatory temperature and symptom check, and mandatory hand hygiene and foot bath prior to entrance to establishments, avoidance of mass gatherings, observance of social distancing, and wearing of masks at all times. In the rural health unit, proper triaging of cases is in place and other engineering controls have been implemented. These controls were not just done in the RHU but all throughout Polanco. Here are some photos of some stores with plastic barriers. Also, part of the new normal is regular disinfection of public offices and facilities. This is done and spearheaded by the BFP and the MDRRMO. For PPE procurement, currently, with the donations and the ones procured by the LGU of Polanco, the PPEs are enough to cover our operations for 2 more months. A PPE donning and doffing workshop was also conducted for the health workers and other frontliners. Next, I want to spend a little bit more time to talk about this next project because I believe it was unique, it was budget-friendly and community-oriented. It was done for the community, by the community. This project is called COVID or COVID-19 Education Campaign. It is a joint project by the Polanco Rural Health Unit, Polanco Sangguniang Kabataan Federation, and the Polanco Department of Education. A little bit of background lang po. Most of the infographic materials related to COVID-19 are either in English or in Filipino. Furthermore, these infographics do not really reach my constituents because internet connection is not widely available here. Out of the 30 barangays, only 6 barangays have stable mobile signal. Some of our constituents are also unable to read and write. Hence, this project was proposed and implemented to educate, empower, and engage the Polanco community to live under the new normal. We wanted to bridge that information gap. Our vision was this: no Polancohanon shall be left behind uninformed about COVID-19 and his crucial role in the infection, prevention, and control of this disease. 3 strategies were utilized to achieve our goal. First, social media publicity for those who have access. Second, distribution of flyers per household to serve as their notes. Next, house-to-house lectures to reach those who have no internet access, to reach those who cannot read. So I'd like to share with you our flyer. This is our flyer that we made in the vernacular of Polancohanons in Bisaya po. 1 flyer was given to every household. And for this project, more than 200 volunteer teachers from the youth and the DepEd teachers were gathered and mobilized. They all underwent a 1-day training for their lecture. Here are some photos of the house-to-house lectures. At the end of the project, over 9,000 households have been reached. And the Department of Education even granted CPD units to the teachers who participated in this project. Furthermore, this project has expanded to involve the work setting. No, all employees of LGU Polanco were invited to attend a lecture on the new normal in the work setting. So that's it for prevention. For the next strategy po, strategy number 2, detection strategies and protocols were placed so that when the lockdown gets lifted, we can monitor where COVID may arise. We can detect possible COVID cases, trace close contacts, and we want to engage the community in case reporting. Under detection, our strategies include heightened ILI and SARI surveillance by the Municipal Epidemiology and Surveillance Unit, coordination with points of entry such as the airports, seaports, and provincial boundaries, establishment of COVID hotlines to ensure that COVID-related concerns reach the IATF. Number 4, mobilization of Barangay Health Emergency Response Teams or BHERTs for detection, reporting, monitoring, and timely referral of COVID-related cases, for the maintenance also of the barangay isolation units, and for participation in contact tracing. Capacity building of BHERTs was done through orientation and lectures, which were personally conducted by the MHO in their respective barangays. Number 5, for detection, I'd like to focus on contact tracing. The local contact tracing team has been organized and established by the municipal mayor through an executive order. The MHO has made a detailed local contact tracing plan and has also trained more than 350 individuals for contact tracing. Primary importance was given to contact tracing so that in case COVID reaches the community, the spread of infection can be halted and contained in a timely manner. Of course, part of detection is testing. Unfortunately, we have no DOH accredited laboratory here in the province of Zamboanga del Norte. Hence, all samples are sent out to Zamboanga City, which is 8 hours away by land. Hence, prudent use of the limited test kits are also being practiced. For the third strategy, isolation, the Polanco IATF has long recognized that most homes in Polanco are not very conducive for isolation and quarantine. Many homes have one bedroom, or some have none. Some have shared toilets. Hence, the Polanco IATF made it a priority to establish isolation facilities to cater to the returning overseas Filipinos and the locally stranded individuals. I am also proud to say that all 30 barangays in Polanco, despite having limited budget, have been capacitated to establish at least one barangay isolation unit each. Our cumulative capacity is 200. Here are some photos of our BIUs. They are transformed structures, and the BIUs are maintained by the BHERTs. We also have 2 community isolation units here in Polanco to cater to those PUMs who cannot be accommodated in their respective BIUs. One CIU is dedicated for females and another is for males. Our total cumulative capacity for our CIU is 34. Here are some photos. The Polanco CIU has also passed the DOH standards and is thus accredited. For the fourth and last strategy, treat, the Polanco IATF has also made sure to prepare for treatment of symptomatic COVID-19 cases. The province of Zamboanga del Norte has only one level 2 hospital. To avoid congestion in this hospital, the Polanco RHU is also doing its part. Suspect, probable, and mild confirmed cases may be admitted in our Ligtas COVID Center. The facility can accommodate up to 20 patients. Our LCC is also DOH accredited. Additional human resources for health and utility workers have also been hired to man the facility. Furthermore, our referral system and COVID pathway separate from non-COVID cases has also been established. And the MDRRMO have been trained to handle and conduct our COVID-related cases. With all of these strategies, COVID-19 remains to be contained in the municipality of Polanco. Since March 2020 and as of July 15, a total of 936 persons under monitoring who are close contacts, locally stranded individuals, or returning overseas Filipinos have been recorded for the municipality of Polanco. 794 have been cleared, and thus there are 142 remaining PUMs. We have recorded a total of 40 suspect cases, have cleared 38, and currently actively managing just one suspect case. One of the suspect cases, upon testing for RT-PCR, later on got reclassified as a confirmed case. Currently, admitted po siya sa aming Ligtas COVID Center awaiting recovery. I'd like to present also with you this data, no? Comparing May and July 2020 on where the PUMs are isolated, a noticeable difference can be seen due to our increased capacity for quarantine facilities. On May 2020, 84% of our PUMs undergo home quarantine despite having other people or housemates at home. But as of now, July 2020, only 11% of the PUMs are on home quarantine. And home quarantine since June 2020 meant that they have no other household members staying with them at home. So no one really gets exposed. And 89% are already on facility-based quarantine. Our testing capacity has also increased. Before June 2020, not all suspect cases get tested, no? Fortunately, since June 2020, at least 100% of our suspect cases already get tested. Next, continuous monitoring of the health status of all healthcare workers were done. As of July 15, 2020, a total of 4 frontliners have reported influenza-like illness. All 4 were tested using the rapid antibody testing, and all results were non-reactive. Only 1 health worker, however, sadly, was tested using our RT-PCR and was negative. Hence, no frontliner had been infected with COVID-19 as of July 15 in Polanco. No COVID-related death has also been reported. So that's it for my presentation. Once again, thank you for your generous donations. It has helped us a lot. And thank you for this opportunity to share what we have been doing here in our munting municipality sa Polanco. Daghang salamat po and good night.
Ang ganda naman ng
Dr.
report.
Chika! Galing!
Ang galing ng Polanco!
Galing ng Polanco. Galing. Dr. Chika, maraming mga fans na nagko-comment sa'yo. So, papakita na natin, shoutout lang natin, no? Sabi ni Kunanan, "Go Chika! We're so proud of you." Ayan, ang galing mo daw according kay Elise. Ayan. Impressive daw ang KPI mo as per Jen. Thank you daw from Hazel. So, yun, Dr. Chika, thank you so much for your presentation.
And Dr. Chika, I would just like to mention, no, grabe ang pag-educate sa people na nasasakupan ninyo. Ngayon ko lang nalaman na meron pa pala sang nagbabahay-bahay just to educate yung nasasakupan nila, because what I see on the internet, kasi yun lang naman yung source of information natin.
Yes.
It's mostly just on social media. Wala akong nalaman na nagbabahay-bahay because of the possible na magkaroon ka ng contact, but oh my God, you were able to do it. And with the flyers, at saka yung, grabe.
You know what's good about what we're doing right now? Kasi mas nakikita yung in-depth details of what the efforts are being made. Surface level lang kasi yung kayang ipalabas sa TV, of course, and sa news, because, you have small airtime. But with this kind of presentation, mas napapakita talaga natin yung efforts and the hard work that everyone is putting in. So again, thank you so much, Dr. Chika,
Thank you
and great
also.
work, Polanco.
Thank you so much,
Thank you po.
Alright. Sige, Dr. Chika. Alright, so yun, Ann, on to
For
our
our
next
next
speaker.
Or ayan, ang ating presenter is from Surigao del Norte. Ang layo ng nararating natin. Dr. J.
Oo.
Remy Gonzalez with a Z.
Dr. J. Yeah,
Hi, Dr.
with the
J.
banner ko talaga. Proud sa
Oo,
banner.
yun na yun.
Hello.
Lahat may
Doc,
banner.
yeah. Pwede na kayo magsalita, Doc.
Hi, good evening.
Good evening, Doc
Hi,
J.
Doc.
Good evening, Doc. Good evening, Doc.
Ayan, hello.
Ayun po.
Yeah, okay.
Ayan, Doc.
you can you can start presenting. Do you have your slides ready na po ba?
Yeah, sige, share screen ko na.
Yes, Doc. You can start sharing your screen. So yun, while Doc is preparing, ayun, God bless daw people of Polanco. And at the same time, according kay Arnel, Doc Chica, maybe you should consider a career in newscasting. Aba? Or maybe a VJ on Mix. Aba.
Kasi
Grabe si
ang
Doc
sarap
Chica.
sa tenga ng voice niya.
Nako.
Naku, na-pressure si Doc J. Kaya-kaya mo yan, Doc J.
Kaya Doc J. Kanyari, radio broadcaster ka
Na-share
naman.
screen ko na. Lumabas pa.
It's not showing, Doc. But just in case if you want, I can help you. I can ready your screen, your presentation sa side ko naman. Do you want to? I guess hindi talaga lumalabas. Sige, ako na lang. I'll just show your presentation and let me know if you want to next. All right? So Doc
Doc,
J, your
baba mo
presentation is live. And Doc, nasa inyo.
Ready naman ako, sandali. Sige. Okay. Sige, ikaw na lang. Sorry, Chico. Ayan. Okay. So, ready? Pwede na? Start na? Okay. Good evening, brothers and sisters, HelpThru donors and ROJDonors, ladies and gentlemen, healthcare providers and COVID-19 in the province of Surigao del Norte. Next slide, please. Next slide. Okay, next slide, please. As of July 14, the Philippines already had 57,545 confirmed cases of COVID-19, with the most affected age group of 30 to 39 years old, and almost half of these cases coming from the National Capital Region, followed by Central Visayas, Calabar Zone, Central Luzon. There have already been 1,603 confirmed deaths and 24,600 recoveries nationwide. Next, please. The province of Surigao del Norte, fortunately, only has 45 active cases, with 37 recoveries and 0 deaths. This, however, has not made the community and its healthcare workers complacent, as hospitals, social-civic community societies, private citizens, and rural health units have been busy taking measures to prepare, acquire PPEs, organize triage, and quarantine centers in anticipation of a probable surge of infection. Next slide. Surigao del Norte was one of those called for lockdown as early as March 16 and declaration of an enhanced community quarantine, which included 1 quarantine pass per household, early curfews, closure of non-essential establishments, house-to-house delivery of food packs, closure of some OPD clinics, and suspension of land, sea, and air travel. Next slide. The stricter entry and movement within the city and its neighboring islands, such as Siargao and Dinagat Islands, though instrumental in halting the entry of disease into the province, made access to health care difficult. This led to a group of private and public health practitioners to create a program that would make health care accessible to patients without compromising each other's safety. Thus, Tawag Konsulta was born. Next slide. Through a Viber chat room, private and government physicians volunteered their numbers and time available for the Tawag Konsulta program. Nurses, drivers, and mental health providers were also recruited, as well as agents that will receive the calls. The program was presented to the LGU officials and promised their support. Next slide. Next slide. This was our initial directory of about 36 volunteer doctors divided into 6 call shifts. Next. Which has since ballooned to almost 50 plus doctors now. Next slide. We got the word out through social media that patients can call certain numbers anytime during the day, 24 hours a day, 7 days a week, and an agent, next slide, will connect them to a healthcare provider who will diagnose, advise, and issue a prescription at no expense to the patient. Next, please. A photo of the prescription is then sent to the nurse in charge and filled by the team on duty if the medication was included in the list of free meds. Next slide. The LGU also volunteered to provide some of the prescription medications for free, relay their laboratory results, deliver them to the patient's residence, and sometimes even provide ambulance service when transfer was needed. Next slide. Shown here are photos of our nurses and healthcare workers distributing free meds to patients of the program. Next slide. Next, please. The provincial government also provided the call agents, nurses, and ambulance drivers with a headquarters at the provincial center where ample compensation, cell phone load, meals, and rest quarters were also provided. Next. There was also a small subgroup created where a callback is done to the patient after the call consult is finished to solicit feedback. This includes a rating for the call agent, a solicitation for suggestions, and a message for their doctor. Next slide. This is a sample of the feedback report for a rating, patient comments, and suggestions. Next slide. Next. As a supplement, the private doctors based in Surigao City also created a Facebook page called Caraga Contra COVID, where patients could send a message, send photos, inquire about the latest updates, put forward their health concerns, or simply chat. Several doctors served as admins of the page and provided quick assistance and replied to the messages quite promptly. Next slide. This also served as a venue for posting updates, infection rates, city and provincial executive orders, and the like solely concerning the Caraga region. Next slide. Next. And just like that, from a simple Viber chat, the medical community came together to keep each other safe and lessen exposure without compromising healthcare and follow-up. Next. It was launched in early April, next slide, and as of July 17, the Tawag Consulta program has already served 904 patients province-wide. This includes neighboring barangays and islands, as well as those in the outskirts of the city. Next slide. Our program was noticed by media organizations and was featured in national news. Next slide. It is our hope that in our limited capacity as private physicians, we have helped dodge a health crisis in our region and have inspired others to be vigilant and community-centered as well. Thank you very much. I think that's my last slide. Please stand by for a news clip aired at PTB4 last May featuring the Tawag Consulta program of Surigao del Norte. So, Chico, can you play the video?
Samantala, kahit may enhanced community quarantine, mga residente sa Surigao del Norte maaari nang magpakonsulta at tumingin ng reseta ng gamot nang hindi kinakailangang tumungo pa sa ospital. Kung paano yan, alamin natin mula kay Venus Garcia ng PIA Caraga.
Stay at home. Ito ang mahigpit na paalala ng pamahalaan. Kaya naman, sa gitna ng striktong pagpapatupad ng enhanced community quarantine sa buong Rio ng Caraga dulot ng COVID-19 pandemic, ay tinitiyak ng lokal na pamahalaan ng Surigao del Norte Province na matutugunan ang pangangailangan sa medikal na konsultasyon ng mga residente. Sa pakikipagtulungan ng Surigao del Norte Medical Society, inilunsad ng LGU Surigao del Norte ang programang Tawag Konsulta, kung saan maaaring kumonsulta ang mga may karamdaman at nais ng payong medikal na hindi na kinakailangang pumunta sa ospital o klinika ng doktor. Gamit lamang ang telepono o mobile phone ay maaaring i-dial ang mga hotline numbers at agad naman itong sasagutin ng nakatalagang Hills 911 agent na siyang mag-a-assist at refer sa naaayong doktor na magbibigay ng payong medikal at reseta. Iti-text naman ng doktor ang online prescription na aprobado ng Food and Drug Administration sa nurse coordinator na siya namang magbibigay sa pharmacist para sa pag-dispense ng gamot at agad naman itong i-deliver sa lokasyon mismo ng pasyente. Ang serbisyong Tawag Konsulta ay bukas 24/7. Ito ay libre at Charge to Medical Assistance Program at Social Services Fund ng probinsya.
Our dear government is very supportive with this activity. Nakita na namin ang mga problema na nangyayari kasi limitado ang ating mga sasakyan na available sa labas. At saka yung may mga iba na takot pumunta sa hospital dahil nga sa COVID.
Sa ngayon ay umabot na ng mahigit 200 pasyente ang nakinabang dito at mahigit 30 pasyente na ang nabigyan ng libreng gamot.
Mapasalamatan din ako sa mga doktor na tumugon o sa mga tawag ko, lalong-lalo na yung mga tambal na hinatid pa dito sa aming bahay.
Ayon kay Dr. Mocoro, ang kadalasan na karamdaman na kanilang natanggap ay may kinalaman sa respiratory condition, pag-ubo, hyperacidity, hypertension at kabilang din ang prostate enlargement at electrolyte imbalances. Kasama si Susil Ragas, Venus Garcia ng Philippine Information Agency Caraga para sa Bayan.
Yan Thank you so much for your presentation, Doc J.
Thank you so much.
Thank you, Doc.
Good job. Good job daw, Doc, sabi ni Virgil. Yan. So, yun. Any last words or pabate or shoutout, Doc J, before we proceed to our next presentation? Wala. Nakamute ka, Doc, ha? Nakamute ka. Ayan. Anyway, I think